I'd like to go over this interesting case here. What you're seeing now as I'm loosening up the cortex is a band of pigmentation here, and this is actually the posterior pigment epithelium. Now you're not really supposed to see this, and you can see with BSS I'm actually pushing it out of the way because it can be tricky when you're trying to remove cortex. You may inadvertently catch this loose pigmented posterior epithelium here. And like I said, it's not supposed to be there. The reason why this is there is because the patient has a history of proliferative diabetic retinopathy, and that can cause fibrous traction, which causes the tissue to come anteriorly. Here the lens goes uneventfully. Again, anytime you're using vacuum, you have to be very careful that you don't catch this pigmented epithelium, because otherwise you're essentially grabbing on iris, which can cause bleeding and can also cause a dialysis. You want to be extra careful. I'm going to play the video for you one more time. Again, now you don't see it at the beginning of the case, which is interesting. I start to notice it midway through the case. And again, I'm just going to push it away here with BSS, but that doesn't really do much because you're going to see that's going to come back throughout the case. Anytime you're using vacuum, as in this case, you want to be extra careful that you're not catching the pigmented epithelium. You want to stay in the bag. Of course, this is above the bag. If you stay in the bag, you'll be fine. You can see how it comes anterior here to the pupillary margin, which is classic for ectropion UVA. Same thing with the eye wall. You want to make sure that the haptics don't catch the pigmented epithelium. Same thing when you're using vacuum here. And basically that's the end of the case. I hope you found this case to be useful, and thanks for watching.